Co-Captain is a Horizon Europe project focusing on the implementation of the patient navigation model for people experiencing mental health problems in context of primary cancer prevention. The main objectives of the Co-Captain project were the implementation and co-design of the patient navigation model and its implementation in 4 different pilot sites across Europe, the evaluation of the model itself, and creating policy blueprints for the rollout of the model across the European systems.
Our service providers today are so busy that it's impossible to build some sort of human relation and interaction. And this is very, very important to feel people listened and taken care of. Patient navigation is key to make cancer prevention more inclusive because it is shaped around people and their needs. And it does that through co-creation. And there are 2 levels of co-creation at the design of the model itself, but then every interaction during the navigation process is a co-creation in itself. It is a model that really is built around what works best for the beneficiaries, and it will be adapted accordingly at different times of the model implementation, at different times of the person's progression. I think these ingredients are really essential for any cancer prevention that is inclusive of the different needs that people have, and the patient navigation model provides for it.
The main lesson learned from the Co-Captain pilot is that the patient navigation model works and it's very flexible as it has been tested in 4 European countries. But in order for it to be effective, it needs to be strongly integrated and embedded within the healthcare system of each country.
When we have been comparing the data from the baseline to the exit from the intervention, we have seen no relevant changes in lifestyles or risk factors, but it's important to say that participants were quite healthy at the beginning of the intervention. But what we have seen as significant and statistically talking relevant changes is in self-efficacy, health literacy, emotional distress, depressive symptoms or anxiety. And that is a very, very relevant result because with these improvements, participants are more willing to make changes in the long term.
We need to have strong coordination and alignment between the model itself, participants and people acting as patient navigators, but also the infrastructure of the healthcare system within the country-specific context. It's really important to have all players act on the same time, and the model should be also integrated within clinical practices around Europe. Otherwise, it won't be as effective as it was for the Co-Captain project.
The main objectives of the Co-Captain project have definitely been achieved. We have seen successful implementation and co-design of the Navigator model across the different pilot sites, and we are very much looking forward to its being rolled out across the European system.